Okay, I think we'll go ahead and get started, everybody. Thank you for joining us today. I'm Michelle Holtkamp, the Director of Communications for FSSA. I wanted to just take a moment to thank all of you who have been meeting with us for months and bringing us important feedback as we've gone through this process. Your partnership has been so valuable and your feedback much appreciated. Today's session will be focused mostly on a summary of our unwind efforts, and we'll be talking about the cost share restart. Just as a reminder, if you have questions, please put those in the chat. We'll take a look at those and answer what we can in our time together here today, and we'll get back to you if needed. And with that, I wanted to introduce Nana Spinner, our Eligibility and Member Services Director.
Thanks, Michelle. Thank you, everyone, for joining us. We'll go ahead and get started. Let me get on the right screen here. So as Michelle mentioned, we're going to do a little bit of an overview, and then we'll go into the cost share restart. So our first post-public health emergency renewals were due in April 2023. And as a reminder, we were given 12 months to finish with 2 months for kind of any remaining activities to wrap everything up. So our final PHE related renewals were due in March of this year. And we have processed renewals for a total of 1,785,104 members during our 12 months of unwinding. And this is kind of a look at what our results were each month. So you can see that largest section there, 41% were successfully renewed ex parte, which means it was an auto renewal. The member did not need to take any action. We had enough information on them that we were able to renew their coverage for another 12 months. A little over 11% were sent a form because we needed some more information on them, and they returned that form and verified that they were still eligible. So they also continued coverage. We had a 3.46%, so a fairly small percent that were closed, and that includes those that were transferred to the marketplace to apply for coverage there. And then a little over 18% that were closed for procedural reasons. As a reminder, all of those individuals did have 90 days after their renewal to come back into compliance and potentially regain their eligibility. And then you can see we had about 26% that at the end of each renewal month, they were still pending. That means they kept their coverage while we were finishing up the work on their case. So combining some of those things from the other slide, we had 52% of the total due for renewal were successfully renewed each month, and 22% of the total due for renewal were disenrolled from Medicaid each month. And as another reminder, through November 2024, individuals who lost Medicaid for any reason can apply on the marketplace at healthcare.gov, and that will take us up to the annual open enrollment, which begins in November. Of those who failed to respond, our records did show that 21% have regained their eligibility by submitting their missing verifications during that 90-day reconsideration period. And that reconsideration period is still active for those who were due in March of this year. So of those who were disenrolled for procedural reasons, our data shows that an average of 35% were known to have other insurance coverage, so Medicaid was not their only coverage. And Indiana, along with Tennessee, adopted the highest number of 1902 E14A unwinding waivers among all states and territories. So we adopted 15 waivers or flexibilities to increase successful renewals and decrease procedural terminations. And this slide shows the results throughout our unwinding period, so the 12 months that we would call the unwinding period. You can see the top line of those who remain enrolled rose over time, which we were glad to see. The percent that was not completed stayed fairly stable across the 12 months. And then the total who were disenrolled, of course, decreased as time went on. For those individuals that were pending at the end of their renewal month, we have been posting on our dashboard and reporting to CMS the outcomes 90 days later. You can find this information on our renewals and outcomes dashboard. I have a snip here so you can see the latest month that we had available was February. So at the end of February, we had 43,000 that were still pending. And you can see 90 days later, we had 31% of those who were renewed, about 32% who lost coverage, and then 37% that we're still working on, but have mostly been resolved by this point. Again, this is a point in time, 90 days after that month. And just to kind of show again our overall enrollment changes. This is not just the unwinding period, it goes to the latest data that we have available. So before the PHE, we were at 1,447,765 members. Our highest enrollment month was May of 2023, where we were at 2,231,726 members. And as of May 2024, we're at 1,977,147 members. And as a reminder, FSSA did make 5 to 7 contact attempts to individuals due for redetermination who did not qualify for auto renewal or ex parte renewal. So we started out our advanced outreach. We used postcards and 211, made some outbound phone calls. And then we sent the warning letter that said, in a few weeks, you'll be receiving your renewal mailer, and here are the things you need to do with that. Then we sent out the renewal packet. We did text messages and outbound calls and emails for individuals who did not turn their mailer in by the due date. And then we also did a search against BMV data to see, are there any that maybe we could find a different address for, and just ensure that we were reaching everyone that we could. And so with that, I will turn it over to Michelle.
Okay, thanks, Nanis. So all of you are very familiar with the outreach efforts that we've engaged in to raise awareness of the unwind. Most recently, we have been focusing, of course, on the people who have lost coverage and making sure that folks are also aware of cost share. So, excuse me, the flyer that's on the screen now is just up to serve as a reminder to you all that this flyer is still available. It's still very much relevant, and we would just ask that you keep this top of mind as you're engaging with people. Go ahead to the next slide, Nanis. And then again, as you know, we've had a robust website really since the start with FAQs, table tents, conversation guides, videos, sample mailers, and more. And that was part of our commitment to have robust information and responsive strategies as we went through the unwind. So again, we're asking for your help. We just want to make sure that we have done everything that we can to make folks aware of cost share and to really simplify the information. And we want to make sure that you have the information that you need to connect with the Hoosiers who will be involved in this. So we're really duplicating many of the same strategies as we restart cost sharing in July for about 1 million Hoosiers. And if you're looking for where to go for resources, really simple, in.gov/Medicaid. And in that top banner, you will see that you can go to the unwind page or to the cost share restart page. Go ahead, Nanis. Just wanted to do a quick overview and reminder again of the key dates regarding the cost share restart. In February, an updated insert was included in eligibility notices. In April and May, the 60-day notification of cost share restart was sent to members. This month, MCE started sending a notice alerting HIP members to watch for an invoice arriving in early July. And I can't believe it, but next week is July already. So starting next week, invoices will be sent in the first half of the month for HIP, CHIP, and MedWorks, and those will be for the month of August. And then in July, co-pays will be active also in HIP and CHIP. Go ahead, Nanis. So on our website, if you take a moment and go there, you'll see that we've really been trying to simplify for members and break the information down. Do I have to pay a cost share? How much do I have to pay? And how do I pay? So that is really how the website is organized. And then all of the materials that we're creating that you can see here on your screen have that QR code that goes to the landing page. So again, all of these materials are available to you in multiple languages to download and print for Hoosiers that you are working with, table tents, flyers, posters, etc. Next slide, Nanis. And then on that page also, we have built a social media toolkit, and we're asking you to please use it to help us reach users who are affected. So it's front and center on this page here, and you can see the download the toolkit here. We've been using these now for several weeks, but if you have not started using them yet, there's still plenty of time. We have 6 more weeks of messages ready for you to use on your own social media platforms. You go to the last slide, I think, Nanis. And then here's just an example of this week's social media post. And if you go to that toolkit and download it, it also includes the text that you could post with the image and the links that go with that message. So with that, I think we're ready to shift over to questions. Nanis, I always go to you, Nanis. Will individuals who are currently in HIP Basic need to pay copays in July? Of special concern are individuals in HIP State Plan Basic who were told not to worry about not being placed into Plus.
Yes, the copays for some services will restart in July. All individuals who are in basic coverage will be given a 60-day period to buy up to Plus if they would like to do so. So that will also start in July, and they can make their payment as soon as they'd like to if they would like to avoid those copayments.
Nanis, can I add one thing to that? We still won't have very many people in HIP Basic in July. We are going to give everyone potential Plus segments in August to pay up. So there won't be a lot of people who have to pay co-payments because they'll still be in Plus for July, but there may be a few. So I just wanted to add that in.
Thank you, Lynn.
How do you identify that a patient has a share of cost plan? What actions need to be taken prior to or after billing?
So I am not a billing expert. My understanding is that if there is a copay due, it will show on the provider portal. I'm looking to see if there's anyone who might know that better. But yeah, I believe that any copay that is due will show on the provider portal. If it does not show, then there is not a copay for that service or that member.
Will the process mirror the pre-PHE process? And are there any differences?
For the most part, yes. Most new individuals will start out in conditional status, which means they've met the requirements, but their coverage will not be activated until they make their first payment in CHIP, HIP, or MedWorks. One difference is for individuals who are on HIP and become conditionally authorized. If they are under that 100% FPL level, after 60 days, we will move them to basic and still give them the opportunity to pay, but this will mean that we have fewer people who are sitting in conditional status for such a long time.
Thank you. When will the fast track process be active on the benefits portal?
Lynn, I believe that's going to be 8/1.
Yes.
Thank you.
Will there be copays for dialysis?
I do not know the copays by program. Lynn, do you know for HIP or CHIP?
I do not think that there are copays for dialysis, but I will check and I can get back with you, Becky Northwood, if you put your email in the chat.
Nanis, can you pull up the slides again and go to the slide with says the main flyer with the QR code? That might be the first one. There's a question about how much longer the old fax number for FSSA will be active. Sunshine, are you here?
But if you have the new one, you're free to go ahead. I would recommend you go ahead and start using the new one.
Thank you.
I will put the new fax number in the chat.
Thank you.
Mhm.
Okay. Are there any other questions? Okay, well, I would just invite everyone to take a look at the website, the outreach kit. Let us know if there's additional collateral that you could use, or any questions that you have, and we'd be happy to take a look. We really appreciate your questions and feedback today. Thank you.